Research has consistently identified violent behavior, such as assault, murder, and suicide, as a possible consequence of moderate to severe traumatic brain injury, and even repeated mild traumatic brain injury. It should not come as a surprise, then, that a large portion of the prison population has been afflicted by brain injuries. The incidence of TBI among U.S. inmates, outlined in numerous studies, have ranged between approximately 25 and 87%. For the general population, it is only around 8 to 15%. Despite this, TBI's impact on society has been largely ignored. It has only been in the past 10 to 15 years that traumatic brain injury has found its way a little more into mainstream conversation. Unfortunately, only because of tragic, high-profile cases. The link between TBIs and violent behavior has been observed and studied for at least several decades, but scientific investigation into its association with the rare event of mass killings is relatively new. In 2014, lead researcher Dr. Claire Alale and her team from the United Kingdom published findings from their comprehensive study that analyzed the psychosocial and neurodevelopmental risk factors in mass murderers and serial killers. It is considered one of the first studies to do so. Of the 239 mass killers that met certain criteria for their study, 44% had evidence of autism spectrum disorder and/or traumatic brain injury. The team also discovered that 81% of the killers who had experienced a definite TBI had also been abused as children, witnessed their parents physically fight when they were young, or encountered other psychosocial stressors. With this knowledge, numerous tragedies can be looked at from a new perspective. In 1927, Andrew Kehoe blew up a school in Bath, Michigan, and then inflicted more carnage when he drove his shrapnel-filled truck into the yard and detonated it. Over 40 were killed, mostly children, and nearly 60 others were injured. Before the attack at the school, he killed his wife and set fire to his farmhouse. It was reported that approximately 15 to 17 years earlier, Kehoe had spent 2 weeks in a coma and 2 additional months in a semi-conscious state after a severe fall. Only a few years before the murders, he received another serious blow to the head from a toppling tree. In the case that inspired the famous book by Truman Capote, the 2 men who murdered the Clutter family in Kansas in 1959 were both seriously injured in vehicle accidents years prior to the tragedy. Richard Hickok's head injury from an automobile accident was so serious that it resulted in several hours of unconsciousness, a permanently distorted face, chronic headaches, and random fainting spells. Perry Smith nearly died from a motorcycle accident that left his legs shattered and resulted in a lifelong dependency on large doses of aspirin. Smith, his siblings, and his mother were reportedly abused by his father. On August 1, 1966, Charles Whitman stabbed his mother and wife to death between midnight and 3 a.m., and later that day killed 14 others, including an unborn baby, with firearms on and from the observation deck of the 307-foot tower on the University of Texas at Austin campus. Over 30 more were wounded, and another victim died in 2001 from the related injury. 2 police officers ended Whitman's life at the age of 25, just over 90 minutes later. It was discovered that he had an aggressive brain tumor and experienced a minimum of 6 different incidents that had a high probability of traumatic brain injury, including a rare lightning strike. One injury qualified as a potential moderate TBI due to loss of consciousness for several hours. He had also been severely abused by his father throughout childhood. In November 2018, Ian David Long opened fire on a large group of people at a bar and grill in Thousand Oaks, California, that resulted in 12 deaths and numerous injuries. His mother reported that Long had begun to, quote, unravel after experiencing a major motorcycle accident years before. Brain injury was not reported. However, the incident cracked his helmet and resulted in a collapsed lung. He had also been later diagnosed with PTSD, combat and military operational stress reaction, adjustment disorder, mixed with anxiety and chronic pain, Long died from a self-inflicted gunshot wound to the head. Both Whitman and Long were veterans of the U.S. Marine Corps and may have experienced exposure to repeated blasts and firearm recoil as well. Research confirms that both may result in mild TBI. Though the cause and execution of violence may be complex, multifaceted, and differ in each individual, there are some suspected reasons why brain injuries increase its likelihood. One aspect of how violence manifests may be the decreased ability to control the behavior. Scientific studies demonstrate that people exposed to moderate to severe traumatic brain injury and repetitive mild TBI are more at risk for developing disinhibition, or lack of restraint in functionalities. This can happen throughout the behavioral, emotional, cognitive, perceptual, and even instinctual spectrum. In turn, thoughts can also be impacted. In 2017, researchers showed that the ability to stop unwanted thoughts may depend on the hippocampal gamma-aminobutyric acid, known as GABA. Since brain injury can result in a decrease in GABA levels, an increase in dysfunction may result. Symptoms of low GABA that often coincide with brain injuries include substance abuse and addictions, insomnia, and short sleep cycles, mood disorders, and sugar cravings. Decision-making involves a complex set of clues, cognitive functions, and emotions that utilize nearly the entire brain. When a TBI affects some part of it, decisions that result in harm can grow for many reasons. Some of the factors that can lead to poor decisions by a person with an injured brain involve the often decreased ability to consider the consequences of actions, problem solve, feel empathy, see relationships, consider concrete and abstract aspects, make effective plans, and more. And as everyone knows, once one uncorrected poor decision is made, it has the potential to lead to another, and another. When a tragic decision is made that results in harming someone, it is often the end consequence of a string of poor decisions, and it can happen to even the most physically sound mind. Brain injury symptoms may also tempt the sufferer into a drug dependency in an attempt to find relief, and that can foster more cognitive, emotional impairments and may hinder the normal decision-making process as well. If traumatic brain injury plays such a significant role in society and affects so many people, why is more not known about it? We will examine that in a future video. Thank you for watching.